I was always interested in health and in helping people, and at the same time I love to do things with my hands. So for me that really married the two together. When I started out in dentistry, I worked a lot with children. I was actually a school dentist. So when we moved to Calgary, I became a regular general dentist and became quite interested in why people have dental problems, what causes teeth to break down, what causes sore muscles.
Dr. Macguire emulates the kind of dentist I want to be and wanted to be when I met her. She was looking at the whole dental patient. She wasn't just filling teeth, she wanted the whole mouth to be healthy. So that's her approach, and that's the approach I wanted to take.
Dr. Lilge and I have been colleagues for a number of years, and we have a very similar philosophy. But Dr. Lilge has also developed a lot of expertise in gold restorations and does excellent work that is very long-standing.
My areas of interest include providing very long-lasting restorations for people, primarily of finer materials like gold and porcelain and things like that. However, to do that kind of dentistry, you really want to optimize the way the teeth come together and the way the dental mouth works. So I like to also work on that holistic, how do the teeth fit part as well.
Well, I started coming to see Dr. Macguire 8 years ago, and it was as a result of referral from my physiotherapist. I was actually in quite a bit of jaw pain at the time. Dr. Macguire is a very professional and charismatic person. She is rather conservative and a thinking type of dentist, and she doesn't do things that she thinks aren't necessary.
I suppose I learned most about honoring the bite and honoring the jaw from my daughter. As it turns out, she had a significant jaw problem, and she ended up having some surgery done in the United States to correct this problem. It was a very difficult and trying time for us, but she came through it with flying colors, and she is not back to where she was before, but she's as good as she possibly could be. And as a result of that experience, she's actually decided to become a dentist herself. Calgary Fine Dentistry, we do everything from cleaning the teeth, full periodontal care, we do teeth whitening, we do tooth colored fillings, we do crowns, we do, if there's missing teeth, we can replace the missing teeth either with a bridge, or we do implant work. The implant is placed by a specialist, and then it is restored. We get the crown put on in this office. I do partial dentures as well. We do part of the lab work. When I'm doing my bite work, I will mount up my models on the articulator so that I can study those models, and that's all done in-house. It's the interaction with the patients that I enjoy the most. I enjoy getting to know my patients. A lot of them become like friends to me.